Is robotic surgery actually less invasive than a normal surgery done by a human doctor?
I can make an amount of mistake, but the robotic thing will not be able. So even it can match millimeter to millimeter.
If it's a non-robotic surgery, do they stand up the very same day?
Pain-wise, result-wise is much better with a robot.
With a robotic surgery. So what about for athletes?
No, for
Vanakkam. Welcome to Wellness Pettagam. I'm Nivedha S. I'll be your host today. I'm a 3-time national kickboxing gold medalist, and we'll be interviewing Dr. Senthil Kamalasekaran.
Hello, Nivedha. Today on Wellness Pettagam, thanks for having me. I am Dr. Senthil Kamalasekaran. I'm a consultant orthopedic surgeon and I'm a sports injury specialist, and I also do robotic joint replacement surgeries.
You do robotic surgeries, right?
Yeah.
So is robotic surgery actually less invasive than a normal surgery done by a human doctor?
The robotic surgeries which we do for arthritis, that's for the other set of population, the people who are elderly with very worn out knees, is a very safe procedure. It is a very quick procedure in terms of the procedure itself, very safe. Because the robot which we use now
is very precise.
Very precise. We feed a CT of your knee into the robot before we start.
Ooh.
So the robot knows exactly where your blood vessels are and exactly how much amount of wear is there and how much cut we have to take. I can make an amount of mistake, but the robotic thing will not be able. So even can match millimeter to millimeter. So the component placements are very good.
Okay.
So the results are also very good.
Okay.
And the safety aspect is the most
So
important.
can you walk us through a normal robotic surgery, like the doctor who's controlling it, what exactly happens?
Okay, so if the patient has come and seen me today for robotic surgery, then I send him obviously we need to make sure they are fit for surgery. So they will get an anesthetic review. If the patient is elderly, they will get a cardiac checkup. Make sure that the cardiologist is also happy. Then they will get a physician to see and make sure if they are diabetic, hypertensive, that everything is under control. We will get the x-rays of the knee, we'll get a CT of the knee and feed it into the computer. And then after that, after they are admitted, the day before the surgery, we ask them not to eat or drink anything. Okay? So 6 hours, they will not eat or drink anything. On the operation theatre, when the patient comes, we normally put them on a small band over here to prevent the blood flow from going to the foot so that we can operate in a bloodless field. Okay. We have arrays which map the blade of the robotic saw to the knee.
That's nice.
Even before we start the surgery, the console can give us exactly what size of implants we are going to use.
Okay.
Which we can match on the table, and if we think there is any mismatch also, we have the option of changing it.
Okay.
So based on that, we take the robotic cuts, and the cuts are taken with the help of the robotic saw, and we are only guiding it.
Okay.
And then basically after that, it is just like any other knee replacement or hip replacement where we just place the components in place with cement.
Okay.
Post-op, most of our patients, they stand up the very same day.
Okay, so is it the same if it's a non-robotic surgery? Do they stand up the very same day?
Yeah, the thing is, the pain-wise, result-wise is much better with a robot.
With a robotic surgery.
Because the amount of bone loss is more with a conventional.
Okay.
With this one, we take millimeters of bone. There we might take little more than that.
Okay.
So the cuts are more, the bone cuts. So in this one, the ligaments are not damaged too much. So it's a little bit more precise.
Okay, so rehab is also easier.
Rehab is easier. They get up faster. They walk the very next day, or even the same day if they are very fit. By the second day, they are done stairs. They've done toilet training, everything.
Okay.
So by second, third day, they are fit to go home.
Okay. Should athletes go for robotic surgeries or conventional surgery?
No, for the athletics, the robotic thing that has not come in for
Okay.
ACL reconstruction.
Okay.
So this robotic technology
This
is
is just made an entry.
it's mainly come for replacement surgery, for knee replacement, for hip replacement, for shoulder replacement, for
Okay.
all those we are having
So for the older population.
for the older population.
Okay. So I guess we're done for the day. Thank you so much.
Thank you.